Hello, and welcome to the AST Answering Your Questions about COVID-19. I'm Emily Blumberg. I'm the current president of the American Society of Transplantation and a transplant infectious diseases specialist at the University of Pennsylvania. Today, we're going to be answering questions that you have posed to us on the Power to Save website. I'm joined today by some colleagues who are also transplant infectious disease specialists, and together we're going to answer your questions. I'm now going to let them introduce themselves.
Hi everyone, my name is Deepali Kumar and I'm a transplant infectious disease physician at the University Health Network in Toronto, Canada.
Hi, I'm Lara Danziger-Isakov. I'm a transplant infectious diseases specialist and pediatrician at the Cincinnati Children's Hospital Medical Center.
Hi everyone, I'm Marian. I'm also a transplant infectious disease specialist in pediatrics at the Children's Hospital of Pittsburgh, University of Pittsburgh.
Hi, I'm Nicole Theodoropoulos, and I'm a transplant infectious disease specialist at UMass Memorial Medical Center in Massachusetts. So first, I'll ask the first question. I'd like to ask Deepali if you could comment on any general findings that we've been seeing COVID-19 in transplant recipients so far.
Thanks, Nicole. So we're seeing the full spectrum of disease in transplant recipients. So we're seeing recipients that have very mild disease, or some of them are asymptomatic, in fact, and we're seeing recipients that have very severe disease with pneumonia. And researchers are looking to see what is it that makes some transplant recipients have mild disease and other transplant recipients have severe disease. So that work is ongoing. The symptoms that we're seeing in transplant recipients are very similar to the rest of the population. So we're seeing fevers in about half the people. Many people are presenting with respiratory disease like cough, sore throat, and runny nose. And others are presenting with gastrointestinal symptoms, so nausea, vomiting, and diarrhea. We're also seeing some unusual presentations like loss of smell and loss of taste. So the presenting symptoms are very similar to those of the general population. What are you seeing in children, Marian?
Yeah, it's an interesting question because similar to the non-transplant population, in pediatrics, the patients tend to be not having as severe disease as our adult colleagues are seeing. And the same thing is true in our transplant population. So more often there's actually no symptoms or mild symptoms. Sometimes there is fever and fatigue the same way, but most of the time they don't need to be hospitalized. Now, having said that, I really don't want anyone to let down their guard if they have a child who has had a transplant, because we need to take it very seriously, and we can't tell at this point in time which one is going to have more severe disease and end up being hospitalized. And on a similar note, the question has always come up about immunosuppression. And Nicole, I wonder if you could help with talking about immunosuppression and what that does for the transplant recipient.
Well, there has been some speculation that immune suppression may help to prevent some of the later complications that we're seeing in patients who have severe COVID-19. But right now, we really don't know how much immunosuppression can help or hurt in this disease process. So the thing that's most important is to talk with your transplant team before you do any adjusting of your immunosuppression, and they'll be able to guide you in what to do. This may especially come up in patients that are being treated for acute rejection. So Emily, what would you say for patients that need to be treated for rejection?
As many of you know, not all rejection episodes are the same or require the same types of medications. And it's important, if you have rejection, that your transplant center individualize your treatment as they would in other circumstances. What we've discovered is we're now able to test patients for COVID prior to treatment for rejection, so we know if there are going to be concerns related to COVID that might change how their transplant center wants to manage their treatment for rejection. Regardless, transplant centers are really continuing to individualize all rejection management, and this is just one more factor that they're taking into account as they think about what's best for you and your episode of rejection. We at this point do not think that having COVID changes your risk, however, for developing rejection. So, thinking about how best to manage patients with COVID, we've been hearing a lot about a lot of different treatments. And I'm wondering whether or not, Lara, you want to comment on what's on the horizon for treatment, what patients are getting now, and what they should probably do if they think they have COVID.
So I think it's really important to understand that currently there's still no FDA approved therapy or treatment for COVID-19, but there are several different medications that are under evaluation. And these are under evaluation as multi-centered studies or single-center studies, or just being collected as people are being treated in large groups of patients from single institutions or multiple institutions, and being combined so that people can understand better what medications may or may not have worked. There are many clinical studies going on, and certainly your team will know if there's a new treatment available or a trial that you would be eligible for, and they would be able to guide you through that process of determining whether or not that would be a good thing for you individually. I think it's also important to remember that while many of the therapies that have been tried have not turned out to work as well, many of them also have had significant side effects and interactions with common medications that are used in transplant recipients, including immunosuppression. So it's important to understand that you should not be trying to take medications or acquiring medications that you've heard about in the media or online or from a friend without consulting with your primary transplant providers, so that they understand what you're doing with your medications and understand how best to ensure that you protect your kidney, liver, heart, lung, or other organ as best as possible during this really trying time. I also think that it's important that you lean on your transplant team as new medications do become available, and they will be able to guide you as best as possible. I think the next thing that we all want to think about is, what if you do think that you have COVID-19? What are the kinds of things, Nicole, that people should be doing if they think that they could be infected?
Yeah, thanks. I think that's a really important question. So if you do have symptoms that you're concerned could be COVID-19 infection, the first thing you should do is contact your transplant team. They'll be able to tell you whether or not you should be tested based on what you're feeling and where that testing is available. Secondly, if you are having symptoms that are severe, including difficulty breathing, pain in the chest, inability to eat or drink, feeling like you're going to pass out, feeling extremely tired, and having difficulty staying awake, all of these symptoms are very concerning and should lead you to going to the emergency room. If you are concerned you could have been exposed to the infection or could be infected yourself and are awaiting a test result, things to keep in mind would be to try to distance yourself from others, including others in your household, if possible. If you do have the ability to sleep in a separate room from others or use a separate bathroom, that would be helpful. Certainly try to hydrate as much as possible. Keep track of how you're feeling and the symptoms you're feeling. Make sure that you take all your medications as prescribed unless you're told otherwise by your physician. Your doctors may be able to do a telehealth visit, so either call you via the phone or use a video to call you to check in on you. And we'll talk a bit more about this later, but wearing a mask will also help prevent you from spreading infected secretions to other people in your household or outside the house. So I think, we're talking about what if we have COVID or feel like we have COVID, but I think one of the most important things is what can we do to keep ourselves safe from getting this infection? So Emily, what would you say for people that want to keep themselves safe from COVID?
One of the most effective things that we're seeing that's really leading to flattening the curve is this plan of social distancing, really staying home as much as possible, not congregating in other places where there might be people around, avoiding going to stores whenever possible, and really trying to limit your contact with the outside world. Certainly you can leave your house, but really you should do it in a way that would prevent you from being around other people to the best of your ability. In some cases, you may be able to take advantage of delivery services for your purchases, things like your medications or your groceries. And if that's possible in your area, you might want to consider that. Whenever possible, we're asking all of our patients to try to get the longest drug supply that they can get. So if your prescription plan allows you to get 90 days, you should definitely order 90-day supplies of your medications. For some of you, 90-day supply is actually not possible usually, but some of your pharmacies may actually allow 90-day supplies during the COVID crisis. For others of you, you still may only be able to get a 30-day supply at any given time. Sometimes if you can order your medications a week early, you'll be able to store up a larger supply that will allow you to go to the pharmacy less frequently. We can't forget that one of the most important things that we can do to prevent the spread of COVID and to prevent us acquiring it is to be very careful in terms of hand washing. It's important to remember to wash your hands frequently, preferably with soap and water, or if not possible, with a waterless hand gel that will actually prevent, that will be a good hand cleaner. When washing your hands, you want to do so for 20 seconds, and you want to make sure you wash all surfaces. Remember that putting on gloves does not prevent you from the need to wash your hands. And so we don't recommend currently the use of gloves routinely, but rather that you wash your hands frequently. Also remember, it's important to avoid touching your face, especially your mouth, nose, and eyes, which are ways that the virus can gain entry into your body. So those are some things that we can do. One of the things we're asked about a lot is the use of masks. And we get this question probably more than any other in infectious disease. Marian, I think you're going to help us figure out what to do about wearing masks.
Yeah, so I'm so glad you asked that. And that is a question that all of my patients and their families ask about as well. And it's been a lot of controversial issues that have come up, but in fact, wearing a mask does help us in several different fashions. It's not perfect, but it will keep you from touching your own nose and mouth. So I brought one with me so I could show you how to properly put it on. Wash your hands first. So I do have hand gel, not soap and water in my office. And then you don't want to touch the whole thing. And if you're using cloth, that's absolutely fine, or a scarf, and you just put it on between over your ears and pinch at the nose. And then you want to leave it. Now, this helps because it keeps you, if you happen to be spraying when you talk and sing, you're not going to be spreading your droplets to someone who's within 6 feet of you. You don't really want to have it under your nose. That doesn't help because I could still rub my nose if it's under that. You don't want to have it over your head because that doesn't help either. And not hanging from one ear, as it just doesn't look good. People ask about, in all seriousness, people ask about N95s. And they're like, if they're right for the doctors, shouldn't we be using them? If the nurses are using it, if the anesthesiologists, when they're going to intubate a person, are using it. In fact, N95s are not going to be better protection unless it's the right size. And when we in the hospital, the anesthesiologists, the emergency room doctors, the nurses who are taking the swabs of people, whenever we're wearing them, we've actually had them fit tested to make sure that the right size and the right one is in fact behaving correctly. There is a shortage with them, and the appropriate people to have them are really the healthcare providers and the first responders. But having your mouth covered does make a difference, particularly when you're in public. So with that in mind, I think there's a couple other things that are worth us thinking about. And that is, we've been hearing a lot about different regions beginning to open up. So I would like to see if, Lara, you could sort of help us with what do you do when we don't have the stay at home and isolation precautions in your region?
So I think that this is a very difficult situation because everyone is still very anxious about what's going to happen when things reopen. We don't really know exactly what will happen. We hope that there's plenty of testing in order to identify people who may be symptomatic early to help arrest or interrupt this transmission and spread. But can you go out? Should you wait and see? I think as a group, we've discussed this a lot, and it's more of a balance of being cautious. Certainly, we would still suggest that you avoid large crowds and other things. It may be a time when you are a little bit slower than your neighbors to go out and engage, that you wait and see a little bit and see what happens in your local community. We're very fortunate now that there's very specific local community information that's available on the internet, and you can actually see what the rates of positivity are in your city, your town, your county, and this will help you decide when you think it's safe to go out, especially as things start to become more active. So I think that that's a balance that people have to take. Some people don't have the option of whether or not they can go out, and maybe, Nicole, you can reflect a little bit on what people should do if they happen to be a transplant recipient and are an essential worker, or if they live with someone who's an essential worker that doesn't have the opportunity to stay home.
Yeah, thanks, Lara. I think, right now, even if your state is still under a shelter-in-place order, some of us are essential workers, and many transplant recipients are essential workers. And then once states start to reopen, you may be asked to go back to work then as well. For right now, I would say if there are still high rates in your area of COVID-19 and you're an essential worker, you could ask for a work exemption. Some workplaces are allowing this, or to be moved to a less risky area at work where you have less interaction with people. Also, if you are living with an essential worker, they can do several things to keep you safe. For instance, when I go home, I make sure that I change my clothing, wash my clothing that I wear at work, and shower right away. I do try to social distance from my family as much as I can so that I don't expose them to something that I could have picked up at work. And so if you are living with someone that's an essential worker, because you are immune suppressed, you may be at higher risk to contract the virus. And so precautions can be taken to prevent you from getting infected. I think one of the most exciting things that's been talked about and that people are really looking forward to is when are we going to have a vaccine to prevent us from being infected with COVID-19. And so I'd like to ask Deepali a little bit more about vaccination.
Thanks, Nicole. So what we don't know at this point is, will COVID go away? And I think that is one of the questions that we're all thinking about. Will it be eliminated completely, or is it here to stay? So I think, you know, one of the very exciting developments in this area is actually vaccines, because vaccines, a good vaccine against COVID is probably what will help to eliminate the virus. So vaccines are being worked on at a very rapid pace. Usually it takes years for a vaccine to be developed. But for a COVID vaccine, because it's a public health emergency, those timelines have been shortened. Even with those shortened timelines, I feel that it will probably be early 2021 before we actually see a vaccine. Now, many countries and many companies are working on developing different kinds of vaccines. Most of these vaccines are non-live or killed vaccines. So these types of vaccines should be safe to give in people who've had transplants. As with other vaccines, when these vaccines are released and they're the non-live type, we think that it will be completely fine to administer them to transplant recipients. But one thing that we'll have to do is we will have to study these vaccines and see how effective they are, especially under the immunosuppressed state. So vaccines are very exciting, but I think they will need some study once they're released, and we really look forward to vaccines coming out for COVID. So I'm going to ask Marian, you know, to talk a little bit about organ donation and whether it's safe to be transplanted in this environment.
Yeah, it's a really wonderful question. You know, not all of the United States or Canada is the same across the entire area, or even within one state or one region, there might be differences on how that place is being impacted by COVID-19 epidemiologically. So what's happening in your area makes a difference. Unfortunately, we have seen a decrease in transplantation when you look at the database from UNOS, the OPTN UNOS database. We've seen that with COVID-19 pandemic, we've had less deceased donors. There's beginning to be a little bit of an upswing again as people are ramping up, as we're having the ability to ask the questions from deceased donors about symptoms that had been there beforehand that may imply that they had COVID-19, and also having more resources for being able to test the donors. So I think that this is a changing area, and is one that we'll see as time goes on, but I don't think it's going to be the same in every single city or even within every hospital in terms of the ability to do the transplant. In terms of, is it safe to do it? You're always weighing the risk of, is it safe to wait for an organ on the candidate list? And weighing that against, in my area, for a very good donor, would it be okay for me to get the transplant? So I think each transplant center is looking at this information in a very, very intense fashion so that they can help develop whether they think for that individual, for you, if it is going to be a good time to take that organ. And I think things will change a bit as well. You know, this is the deceased donors, but the living donors are another area that is very important and has had an impact. And I think, Emily, I'd love to hear you really expound on how that's been impacted.
Yeah, thanks, Marian. I think a lot of people are hearing that live donor programs have been suspended in many areas of the United States and Canada, as well as worldwide. There was a sense as COVID was hitting our shores that we needed to be prepared to take care of a lot of patients who might be coming to the hospital. every hospital worried, would they have sufficient resources, sufficient beds, sufficient different types of beds, including ICU beds, to manage the patients we were expecting to see who would have COVID. For this reason, many hospitals decided they were going to suspend scheduled procedures where they were able to do so. And live donor transplants fell under these scheduled procedures in many hospitals. And so each transplant program had to specifically examine what the need was for a live donor transplant within the upcoming month or two as their hospitals adjusted to the new reality of taking care of non-transplant and transplant patients with COVID. Now, due to a lot of great work on the part of patients and healthcare providers everywhere, we've learned that we can actually do things that have decreased the spread of COVID throughout the world. And because of that, transplant centers are again beginning to think about resuming live donor transplants in those areas where these procedures were being held. In order to make this safe, both for the donor and for the person awaiting transplant, most centers are carefully planning to do this, where they will consider testing of both donor and candidate prior to starting the procedure and making sure they have the resources on board to safely care for these patients. So if you've been waiting for a live donor transplant and wondering if it's ever going to happen again, you should talk to your center about what's going on in your particular area and at your special center to try to figure out what the timing will be for your live donor transplant. I can tell you though, in talking to people throughout the United States, it's clear that every transplant center is trying to figure out how to bring this procedure back to their center as safely and as quickly as possible without jeopardizing the safety and health of either the donor, the candidate, or the patients requiring care for COVID in their centers. So stay tuned. I think we're going to be learning more about live donor transplants being up and running in more places in the next few weeks and certainly the next couple of months. So a lot to look forward to. We've tried during this webinar to answer your questions, but you probably have some more. So I wonder, Lara, if you can tell us about the resources that are available for patients to learn more.
I think that that's really important. There's so many resources that have been developed that are available in multiple languages, including English and Spanish. There's COVID-19 facts for transplant candidates and recipients that are available both from the American Society of Transplantation at myast.org, as well as the powertosave.org website. These are updated periodically in order to provide the most recent information. There's also from UNOS, there's something transplantliving.org that has up-to-date information. But also there's local and national and worldwide data to help you understand what's going on through the Centers for Disease Control and Prevention, as well as through the World Health Organization. And these are all resources for you to get the most up-to-date information, not only related to transplantation, but related to protecting your family members and people in your community against COVID. Thanks, Emily.
So I'd like to wrap this up by thanking my wonderful collaborators, this powerful group of transplant infectious disease professionals with whom I've had the pleasure of working to help develop these resources along with others in our society. We also want to thank you, the transplant community, for helping us know what questions you have and for being so interested in this topic and listening to this webinar. We want you to know that your health and well-being is ever in our minds as we continue to provide resources to work with you to make sure you're well informed and staying healthy. Please be sure to let us know if you have other questions by posting them on the Power to Save website. and we will try to continue answering them as they come up. I'd like to thank Izzy D'Onofrio and Shandy Covington, our staff at AST, who've been helping us throughout this webinar and whose faces you haven't had the opportunity to see. So thank you all. Stay well, be well, and remember to let us know if you have other questions or concerns. Bye-bye now.
Wash your hands.